So my name is Dr. Nadeem. I'm a consultant plastic surgeon, head of Department of Plastics and Reconstructive Surgery here at Zahra. And with me is Dr. Ricardo Prasad, head of ENT surgery. Now, Dr. Ricardo, I've seen on Instagram, Facebook, Twitter, and YouTube talking about Povidone and Iodine. Now, we're both from the UK. England's going into a second phase of lockdown. What are your thoughts? Because obviously it's not working.
Yeah, well, the measures recommended by the public health doctors, i.e. wearing masks, social distancing and washing of hands, don't appear to be working for various reasons. So I think the stage has come now where we need to think outside the box or more laterally. And if we can recall the treatment of Mr. Trump with a non-FDA approved cocktail of antibodies, this clearly shows that the doctors were thinking beyond evidence-based medicine and applying their clinical experience and common sense to the management of COVID-19. I strongly believe that the game changer is Povidone Iodine. This, I will go as far to say that this is probably the most potent weapon we have in our antiviral armamentarium to beat COVID-19.
Now, I've seen lots of Instagram posts by you. I've seen a lot of Twitter posts by you, even to Donald Trump. You know, obviously you strongly believe in what you're saying, but where's your evidence? You know, where is the evidence that this will work? This will either stop or delay a second wave?
That's a very good question. The evidence is based on scientific studies that have been done on Povidone Iodine and COVID virus. There have been multiple studies from the time of SARS, MERS, and COVID-19, where Povidone Iodine has been shown to be virucidal against all these viruses. They've also been, I've also had personal experience with the use of Povidone Iodine in patients that I have seen in my clinic who were positive with very few symptoms, and they've used iodine, they've become negative and symptom-free. I've been using it myself for the past 9 months, and so far I haven't contracted the virus. My colleagues have done the same, and we all see COVID patients on a regular basis. So I strongly believe that this is the game changer and probably the silver bullet to prevent and control COVID-19.
Okay, so that's all very well. Now, the World Health Organization has taken a lead in managing this pandemic, often producing guidance. Has the WHO commented on Povidone Iodine and its usefulness?
Yeah, indeed. They have produced a document, interim guideline document for surgeons working in the oral cavity, i.e. mainly the dentist. And they recommend that all patients going to the dentist should actually gargle with Povidone Iodine to reduce the microbiological load in the oral cavity, including COVID-19. So WHO has recognized a role for Povidone Iodine in the management of COVID-19. But I feel that they fall short in recommending this antiseptic for the general public to prevent COVID-19. And I hope that they will be watching this video and take note and hopefully take the next step to recommend Povidone Iodine for the prevention of COVID-19.
Now, so you're quite an intelligent chap, but for the laypersons watching this video, how can you explain to them how but Povidone Iodine works in preventing COVID-19 transmission?
Well, if we consider gargling with it, 0.5% for 15 seconds, and putting a little bit of it in the nose in the forms of drops or on a cotton bud, we can clear the reservoir of COVID-19, which is mainly the nose, the back of the nose and the throat. And by clearing this reservoir, it prevents the virus from shedding to the rest of the body and also prevents the virus from moving from person to person. Okay. So it's actually a disinfectant that sterilizes these areas. And these areas, the nose, the back of the nose and the throat, are the main areas where the virus take hold of the body and then is transmitted to the rest of the body.
Okay. So Dr. Ricardo, You talked about gargling, douching the nose, but we all know the virus also goes to the lungs. Surely you can't put disinfectant into the lungs. How is your Povidone iodine going to address that issue?
Well, we need to go back to the mechanism by which the virus take hold of the body. The virus enters the body via the nose and the mouth and becomes attached to the ACE2 receptors, which are predominantly in the upper upper airway.
Okay.
From these regions, it replicates and then sheds to the rest of the body. So the majority of the virus is actually in this area, and a small amount is shed. If we can get rid of the virus from the top end, the little bit that goes to the lungs or the rest of the body will be dealt with by the body. So the viral load is reduced, and this will prevent the infection from changing from a mild infection to a very severe infection.
So suppose I am going to use Povidone iodine. Is it commercially available? How do I get it?
Well, it's actually available commercially as a mouthwash. At the moment, there is no nasal preparation of Povidone iodine. So one needs to dilute the mouthwash to 0.5% and apply it into the nose, either as a drop or using a cotton bud. We hope that in the future that there will be a nasal spray that we can use in the nose. And I think many companies are working on this now. But at the moment, there's no commercially available nasal spray. We have multiple brands of mouthwash with Povidone iodine. They should be diluted to 0.5% because all the studies have shown that 0.5% over 15 to 30 seconds is virucidal to COVID-19 virus.
So if I want to protect myself, how often should I be doing this every day?
Well, if you are a high-risk person, for example, dealing with patients every day who are potential carriers of COVID-19, then you should be using it on a daily basis. Once a day is adequate. If you go to a crowded place or to a restaurant or bar, or even at university or school, again, where there's a high risk of contamination, you should use it once a day. However, if you are at home all the time with no contact with patients, you can use it at a frequency of once every 3 days, and this will be protected. I think the elderly population who is most at risk should adopt a policy of using it once a day to protect themselves.
Okay. I mean, I don't know how to use it. I just guess gargling is gargling and putting cotton wool swab up the nose, which will probably work. Is there anything online that I can see to show me how to do this?
Well, you can watch my videos, but generally the oral way of using it is first to rinse them out, and you can do this for about 15 seconds, and then you gargle for another 15 seconds. That will give you the 30 seconds, which will inactivate all the virus. And for the drops, you can put it in a dropper bottle and just tilt your head back and put 2 or 3 drops in your nose once a day. That should be adequate.
And it doesn't have a bitter taste or anything like that?
Well, it has a taste. If you cannot tolerate the taste, you can mix it with some Listerine Zero or any other mouthwash that will give it a good flavor.
And that won't reduce the efficacy?
No.
Okay. Well, thank you, Dr. Ricardo, for giving us those answers.
I just want to summarize that I strongly believe that Povidone iodine is the silver bullet to control and prevent COVID-19 infection. And I hope that this video reaches the WHO and they will take it seriously. I want to add as well that the reason I think the WHO hasn't recommended it as yet is because we don't have at the moment any clinical data to show that Povidone iodine destroys the virus inside the nose or the mouth. All our data is based on laboratory studies. And there are many studies in progress now to address this issue. I myself am conducting one study along these lines. But because the crisis is here with us and because the second wave is taking so many lives, I feel that we should adopt this protocol now rather than wait until the data is available. I would like to mention that as a scientist, the lack of evidence does not necessarily mean evidence of ineffectiveness. So not because the clinical data is not available yet, we should wait. I think we should get on and use it. Primarily because I believe that it works, and secondarily, it has no side effects. There is no harm in using Povidone iodine, except in the very rare case of allergy. So you have nothing to lose. And I know countries like Japan and India, they've started to use this on a wider scale. And I think they're getting the disease under control. The use of Povidone iodine should complement the measures that we have in place now, such as wearing masks, social distancing. And I believe that it should be placed on top of all of these measures, as I believe it's the most powerful tool we have available now.
Okay, so another part of the armamentarium against COVID.
Exactly.
So Dr. Ricardo, you talked about the virus and the importance of reducing viral replication in the nose and the oropharynx. So what's going on in the lungs? Why are all these people getting coughs and all these pneumonia, having to go onto ITU, requiring oxygen therapy, CPAP, ventilation? It's all happening up there. What's going on in the lungs?
So first of all, the virus replicates at the back of the nose and then sheds downwards towards the lungs. Now, there's a small amount that reaches the lung, but the majority of the problem in the lungs are due to vascular event as a result of the virus entering the blood and then causing microthrombosis within the lungs. This is the mechanism of the ground glass appearance that we see. It's due to thrombosis in the microvascular system rather than the actual virus causing consolidation of the lungs.
So how are your recommendations going to help?
So the Povidone iodine reduces the viral load in the upper respiratory tract, and this will prevent less shedding down to the lungs, as well as less virus entering the blood and causing these microthrombosis. It also prevents the transmission from person to person via sneezing, coughing, and speaking.
So do you think, we've both got masks here. Do we still need to wear masks or not? Or should we wear it regardless, just to make sure we reduce the risks as much as possible?
Well, I think the complexity of COVID-19 requires a multitude of measures in order to control it. And Povidone iodine is just one of them. Wearing a mask is another one. Social distancing, and also hand washing and avoiding crowded places. So it's just an addition to the current strategies that we have to control COVID-19. Okay.
So Dr. Ricardo, I think that helps explain, at least to me and to the people watching this, and as they often say in the UK, every little helps. Thank you.
Thank you very much.